Hey guys, so I have received few comments about to teach about the axilla. So here I am today with the topic axilla. So what does this axilla actually mean? So it simply we say it's an armpit. Yes. So the simple armpit region, why it is so important? Because there are so many neurovascular structure that will enter and exit this area to reach their target location. So how where it is exactly located? It is located between the arm and the thorax. So between the arm and the thorax, what we find that area is called the axilla. So now let us talk about the connections of the axilla. Superiorly, it will be communicating with the neck, anteriorly communicating with the thorax, infralaterally with the upper limb, inframedially with the thoracic wall. These are the connections of the axilla. So in the skeleton, if we see, this region is called the axilla. Superiorly communicates with the neck, inframedially with the thoracic wall, infralaterally with the upper limb. Okay, these are all the connections of the axilla. Now coming to the things what we have to learn about the axilla. This axilla, it is a pyramidal shaped structure, so it will be like this. So this is called the apex, or also called the cervico-axillary canal. So why cervico-axillary canal? Because there are some structures that are coming from the neck to the axilla, and some structures leaving the axilla and entering the neck. Therefore this apex is called as the cervico-axillary canal. Okay, now let us talk about this apex in detail. So, in order to know about the apex, you need to look from the top view. So, when you look from the upside, you can see that the apex is bounded anteriorly by the clavicle, medially by the outer border of the first rib, this one, and posteriorly by the superior border of the scapula. This is the superior border of the scapula, clavicle, and this is the first rib. So, these will be bounding the apex of the axilla. Now coming, it has an apex. Sorry. So it has an apex. Now we come to the base. So base is nothing but a skin followed by the subcutaneous fat and then the axillary fascia. All together will be forming the axillary fossa or the armpit. This comes the base. Now we have discussed about the apex and we have discussed about the base. Now this is the anterior, so this entire thing is the anterior wall, and posterior to it present is a posterior wall, and later you'll be having this medial wall and this is the lateral wall. First let's talk about the anterior wall. So we know that from here you'll be getting the pectoralis major muscle, and inside it will be having the pectoralis minor muscle. These two major and minor muscles will be forming the anterior wall. So very inferior aspect of the anterior wall, you'll be having a fold like structure formed by the pectoralis major muscle, and that is called the anterior axillary fold. Now let's talk about the posterior wall. The posterior wall is simply formed by the scapula, and on the scapula, so if we consider this as a scapula, anteriorly it will be having the subscapularis muscle. So posterior wall is formed by the scapula and the subscapularis muscle in it. So posterior aspect also on the inferior most aspect will be having the teres major muscle and latissimus dorsi muscle, which will be forming the posterior axillary fold. Now coming to the medial wall. This medial wall, if you see, so here what can which muscle we can see here? So arise from the ribs like this. This is the serratus anterior muscle. The serratus anterior muscle on the 1 to 4 ribs will be forming the medial wall, and the lateral wall is actually bony. It is formed by the intertubercular sulcus or the bicipital groove of the humerus. So this is the lateral boundary which is bony. So here what you have, the sulcus, intertubercular sulcus or the bicipital groove, where you'll be having so many tendons. So this, yes, so this comes the boundaries of the axilla. So anteriorly formed by the pectoralis major, pectoralis minor, posteriorly the scapula and subscapularis muscle. So posteriorly, very inferiorly, what you find, the latissimus dorsi and the teres major. Medially will be having the serratus anterior, and laterally you'll be having this intertubercular sulcus, where you'll find the bicep brachii, brachialis tendon, etc. Okay, so these are all comes the boundaries of the axilla. Now coming to the content. So what are all the contents you can see here is mostly the fat and the connective tissue. You'll be having lots of fat here, and axillary sheath which will be surrounding the axillary vein, artery and the brachial plexus. So see, if you see here, so this is the axillary sheath which is bounding the axillary artery, axillary vein and the cords of the brachial plexus. Next, we'll be having the lymphatic vessels, lymph nodes, which are namely called as axillary lymph nodes, which play very much clinical importance in case of axilla. Okay guys, in this video, what all we have discussed in a nutshell is introduction to the axilla, its connections, its boundaries, and its contents. So this is all about the axilla. In my coming videos, we'll talk more in depth about the contents like axillary artery, axillary veins and axillary lymph node. Thank you for watching the video. If you really found it easier, share it with all your friends and do not forget to subscribe to my channel. Thank you. Good wishes.